Hey everyone, welcome back to the YMyHealth podcast. I'm your co-host for this episode, Melissa Shankman. Today we're going to be talking about a topic that is becoming more and more widestream, really, especially for millennials, which is ADHD and people being diagnosed in their 20s, 30s, even in their 40s. After all these years thinking that, this was a childhood diagnosis, and that is not the case. And we are so fortunate to have Bailey Pilant here with us. She is a licensed mental health counselor in New York State and a certified ADHD clinical services provider who specializes in working with clients with ADHD. So Bailey is a licensed mental health counselor in New York State and a certified ADHD clinical services provider who specializes in working with clients with ADHD, autism, anxiety, PTSD, and trauma, all in which she offers neurodivergent-affirming therapy and takes a holistic approach to mental health, which is so, so important. Bailey, you also have a particular focus on women's mental health and working with women who are in their early 20s and 30s, which is a time of a lot of life transitions. For sure. And you also, on top of all of that, bring a personal perspective because you experienced a delayed diagnosis with ADHD and with autism yourself, so you know firsthand what that is like and how to provide, optimal support in these areas. And so we're just really excited to have you join us on the podcast.
Thank you so much. I'm so excited to be back and to be recording, and I'm really excited about this conversation we're going to have today.
Well, same here. Very excited to have you. I think to start, kind of, I'm curious, and I know our community will be. For so many years, you experienced this. You experienced these symptoms, not knowing, exactly what was going on. And when it came time professionally to choose what area of mental health support you were going to provide, and there's so many different options, why did you decide, being someone who had, the delayed diagnosis with ADHD, what made you decide, okay, I want to help others with this particular condition?
Yeah, I think everything is always such an interesting journey, and life experiences can really help us come into ourselves too. But what really made me want to specialize in neurodivergent women is I was actually working in an outpatient mental health clinic on the Upper West Side of Manhattan. And we were a nonprofit, and I was working with just such like a diverse background of people, but I primarily was still seeing mostly women and young women at the clinic. And I started to notice this pattern that a lot of our clients who are coming in and out of the clinic were receiving a very specific form of diagnosis. So, but what I was seeing is that I was receiving all of these young women, and they were all being told that they were anxious or depressed, or that their symptoms were just related to trauma. And I remember going through one of my clients' charts, and I was like, wait a minute. In her chart,
Yeah.
she does have an original diagnosis of ADHD. And why has
Yeah.
everybody been labeling her as anxiety? And why is nobody actually trying to treat the ADHD? Now, when I started grad school, I'm going to kind of backtrack a little bit. When I started grad school,
Yeah.
before I did that, I had an interview for my program. And I remember in the interview, they asked me, like, what is your goal? Like, why do you want to go into this field? What is the
Mhm.
motivation for becoming a therapist? And I had talked about my experience with having disordered eating, but I didn't talk about the ADHD, and I didn't know the autism existed back then. But I primarily focused on like my experience with disordered eating and wanting to help women in the future who struggled with disordered eating like I did. But it's so funny, just like as I went through grad school, that's when I started realizing more and more I can't ignore this part of me that is the ADHD, because it's having real effects on my ability to show up and go to school and study and do the things that I want to do. And I realized, and I remembered from when I'd first gotten diagnosed, that a lot of my school anxiety had to do with my ADHD and feeling really concerned about my
Mhm.
ability to figure out how to study, how to take tests, how to decipher what information was the most important information for me to hold on to and what information to filter out. I really struggled with a lot of those skills. And it would make me
Yeah.
so anxious about my ability to show up, go to school, do well at school. And I really wanted to do well in grad school. And so that's when I started going like, okay, I think I need to address the ADHD. And in doing so, school went really well for me. I graduated. You can't see it here, but up there, I graduated with an award, the Bufano Counselor Excellence
Wow.
Award. I graduated with straight A's, and I was really excited for myself because I was so scared that I wasn't going to be able to do it. And I had real
Oh,
fears
no.
about my ADHD getting in the way of me being successful at school and even my ability to be successful as a therapist post grad school. And that's when
Sure.
it kind of started to get the ball rolling that, like, maybe we aren't talking about ADHD and the way that it impacts us enough. And maybe my understanding and the way we're taught about ADHD, the way we're taught about autism and neurodivergence, I think we might be missing something. And I kept coming back to that in my work. And
Yeah.
so then flash forward and this client that I mentioned, and I see in her chart ADHD, and I'm like, why are we not addressing this or talking about it? What's going on here? And I realized that a lot of my clients, when I would actually ask them more in depth questions about their anxiety and what they were labeling as depression, was actually executive dysfunction underneath all of it. And I realized these clients probably aren't struggling with anxiety and depression. They're probably struggling with ADHD that is causing anxiety and depression. And when I started focusing more on the executive functioning skills, that's when I started to notice an improvement. But then I started also experiencing challenges and issues with advocating for them to get medication management that would actually help them. And there was
Mhm.
a lot of stigma around prescribing stimulant medications, and that
Yeah.
really made me mad. And then what made me even more mad was when I had a conversation with the medical director who mansplained to
Yeah.
me how anxiety shows up in ADHD. And I said, yes, if you go and look in the client's chart, I have accurately documented every which way that the anxiety is exacerbated and caused by the ADHD and the ADHD not being treated. And I was so mad. I was so mad. And I remember hanging up on that conversation. Also, it was on my birthday, so I was even more mad. And so as a woman
Oh
with
gosh.
ADHD who had been missed, who, like, if someone had taught me about my ADHD at 17 when I got diagnosed, I think I would have had a
Yeah.
completely different experience in grad school, in undergrad, and so much of my early 20s would have looked very, very different.
Yeah.
Now, I wouldn't change it because I know what I know now, and I think that honestly, I truly think that the providers who treated me back then, they were doing the best they could with what they knew as well. But I thought about that, I was like, if more people only knew, if more women only knew
Yeah.
that that these things can go away and get better if we actually address and acknowledge the root of it. And that's what I started seeing too in a bunch of clinicians who stated to specialize in ADHD or to like work with ADHD. And I kept having clients come to me and saying, well, I worked with a therapist and I told her about the ADHD, or I told him about the ADHD, but they told me that I needed to focus on working through the anxiety first. And I was like, but they got it all wrong. If we start with the ADHD, the anxiety is going to go away. And sure enough, it did. And so that's what really started to motivate me, was that, like, I was frustrated with the lack of information, the lack of qualifications. I was tired of the stigma. I was tired of women
Mhm.
being missed. I was tired of people being misdiagnosed, misunderstood, mistreated. And because what happens when we go so long being mistreated for our symptoms is we start to internalize that our mental health is our fault and that the ADHD must be our fault, and that
Yeah.
we're not trying hard enough, we're not doing hard enough, we're failing. We're the reason why therapy hasn't worked. When the reality is the reason therapy hasn't worked is because it hasn't addressed or acknowledged the thing that's actually going on, which was the ADHD or the autism, etc. And so really anger, that's what fueled me.
Yeah. Anger is a good fuel. Anger is a good fuel. We've had other fellow millennial guests on the podcast who do health advocacy work, and they were
Yeah.
like, and we asked them why, like, what keeps them going back, and they're like, "Anger." So
Right.
we appreciate, yeah, we appreciate that very much, and you do great work because of that. It just enhances the quality of the work and, what you can do for others. Are there certain things about ADHD that you have found surprising, both as a patient, and a practitioner? And what are some things really that the majority of the public might not even be aware of when it comes to living with this condition?
Yeah, so the main stigma around ADHD, and I still face this a lot with like my elder millennial clients who come in
Yeah.
with a new ADHD diagnosis, and there's this like disbelief of like, is it actually ADHD or am I? Is it actually just anxiety or depression? And that has to do with like what we've been taught about ADHD. And so I think in general, the biggest stigma that I see around ADHD is people think that it's an attention deficit hyperactivity disorder because that's the name of it, right? And really, ADHD is mislabeled, and we really need to be calling it something else. Now, what we really should be calling ADHD is an attention dysregulation disorder, not an
Mm,
attention deficit disorder, because it's not that we lack the ability to sustain our attention, it's that we struggle to regulate where to put our attention and where to hold our attention. And we are an emotionally motivated brain. So it's a when we are really interested in something, we can hold our attention and sustain our attention for a long time. But when we
mm.
really are not interested in something, it is so much harder for us to sustain that attention. And then we have this hyperactivity piece, right? And hyperactivity is also, that word is also really misleading because when we think of
Very.
hyperactivity, we're thinking about little children who can't sit still, who are always bouncing around, who always need to be moving, who are really fidgety, who have so much extra energy. And especially when we're adults, majority of us, we're exhausted. And we're like,
Yeah,
I'm so tired, but like I can't sleep. I can't
yeah,
get my brain to turn off. I feel like I'm racing against a clock and I don't even know what this clock is set to. And
yeah.
so this hyperactivity also gets mislabeled, misperceived, and really hyperactivity, I don't have a better word for it, but there's this internalized hyperactivity that also occurs that people forget about. And that internalized hyperactivity is like our thoughts jumping, our inability to be able to relax our mind and our body, right? And so there's this, we're sitting in this constant like agitation and tension and not sure where to put it or how to use it.
That's extremely fascinating to think about, and it also makes so much sense, though, as you describe it, because really, that's true, like, people are, I mean, that is a common theme amongst everyone I know. Everybody's tired all the time because 'cause they're busy doing so many things, and so they're not running around in that sense, like you're saying, but then everybody will say, "I'm so tired, but I can't sleep." Yeah, yeah. So that makes so much sense. It really does. Um, when it comes to the number of people who are being diagnosed at 20 and beyond, with ADHD, it's really skyrocketed and it's gotten a lot of media attention, like I said in the beginning. And some of these numbers are honestly, to me, they're staggering. So I'm going to read some of the statistics. So, okay. So in recent years, and even more staggering for women, way more than men. So in 2024, so not very long ago, I believe this was, I want to say it was in July of 2024. The CDC, so the Centers for Disease Control, they have this very famous journal, that the listeners may or may not be familiar with, that's out all the time, and it's this morbidity and mortality weekly report, and they focus on all different types of conditions. And so in this particular week, they were focusing on ADHD. And 2 statistics are pretty unbelievable. One is that a quarter of women receive an ADHD diagnosis before age 11, compared to 45% of men. So let's just take that one in for a second. I know. And then the next one that I was like, "Oh my gosh, 61% of women receive their ADHD diagnosis during adulthood, compared to 40% of men." Those are pretty staggering numbers. And I know, like, in your previous episode, that you were in with Julie, which I encourage everyone to listen to, is phenomenal, and Bailey shares her personal path, um, her journey with ADHD and with autism and how it's informed her providing therapy and mental support to others, so encourage you to listen to that. I know you talked about how women receive a later diagnosis because of research not being performed on women, which is so disheartening to hear because we hear about this in so many areas. And now this is another area we're hearing this about it, and we're also talking about the types of behaviors we're raised to have, which mask the symptoms and even hormonal changes. I'm curious, like, how do you think the stigma of ADHD in general and the challenges millennial women in particular face in the healthcare system are affecting these delayed diagnoses?
Oh, such a good question.
Thank you.
And super complex to kind of answer. But
Yeah.
before I even go into answering it, I know the numbers feel really staggering, right? Like the
Yes.
percentage, but then also the sheer amount of people who are receiving a diagnosis. And so people, I think we get really fixated on these numbers and being like, why
Yeah.
is there such an increase of women? Does everybody have ADHD now? But like what's really sad, and I'm gonna give you a different statistic here,
Yeah, please.
only 7% of those of us with ADHD will receive an accurate diagnosis of ADHD in our lifetime. So,
Incredible.
only 7% of people with ADHD actually receive a diagnosis. That's so little.
Terrible.
It's
Yeah,
so cool.
it's
That
minute.
Yeah. So even though it
Yeah,
feels like so many people are being diagnosed with it, and the reality is like there's still a huge gap happening here. And
yeah,
this gap is missing a lot of people, and it's really making treatment very their treatment, their experiences even harder. And the other thing, here's another fun stat for you, that is
yeah,
so a little jarring, a little scary to think about. So if only
yeah,
7% of people are receiving an accurate ADHD diagnosis, the hope is that that 7% is actually getting like accurate treatment for their ADHD, right?
yeah.
But what we have found is that even though people are getting diagnosed with ADHD, there is a lack of treatment and a lack of utilizing the proper medication management for
Mhm.
treatment. And what studies have found is that those with ADHD who go untreated, on average, live 14 years less than those who do get treated.
Oh, that's horrible. Oh my
14
gosh.
years.
Wow. That puts really the numbers that I was sharing into even more perspective.
Yeah.
That's terrible. Things have to, and I know you say this, I'm sure, every day. Things have to change, and you're a big part of that change, which we're very grateful for. But that's just unbelievable to think about because it affects so many areas of your life, which we're about to go into. Um, I think it would be very interesting because especially for women in particular, like I would assume there's more of a variation in the kind of symptoms for men versus women. So if you go into those a little bit, and then I'm also wondering, okay, one of the things which Julie and I deal with all the time with Why My Health, the millennial age span is huge. You've got people in their late 20s, you've got people in their entire 30s, now you've got people in their early 40s. There's a lot that happens in all these years for women in particular. And so I'm wondering, first, men versus women in terms of symptoms, but then also how do symptoms for women change throughout these different decades?
Yeah, no, this is a really great. And so I'll try and go like high level and zoom in as
Okay,
much as I possibly can here.
perfect.
When we're talking about symptoms, for women, our symptomology tends to be masked by how we interact in the world socially. So
Mhm.
we don't give that like typical presentation that men do because we're constantly trying to overcompensate and hide our symptoms, right? So where a little boy may like be really restless and like can't sit in class, you're going to have a little girl who's sitting there twirling her hair.
Mm,
Right? So, yeah,
yeah,
she's not bouncing off the wall, but she's sitting there really nervous. There's that energy, right? She's twirling
yeah.
her hair, picking her fingernails, and
Mhm,
biting her fingernails, right? Uh,
mhm.
there's like the clicking of the fingernails, tapping her foot subtly, right? The constantly shifting positions. Uh,
Yeah.
if anybody actually watches like the video of this, you see me shifting positions all the time. And that's just like subtle ways in which like my ADHD shows up when I know that I need to sit still, but it's like almost
Sure.
like meditating to sit still. So,
Yeah.
but I found ways to make it look socially appropriate, right? As
Yeah.
it as well. And then when we are thinking about, so ADHD is an executive functioning deficit disorder. So we're looking at executive functioning skills. So like working memory, um,
Mm,
working memory for girls, I there's really no difference in the working memory deficit in boys and girls and how it shows up.
mm,
It really has to do with like social perception around it. So a girl with working memory deficits is labeled someone who's like um ditzy, right? She's
mm.
just in her own world. Oh, that's just Bailey. She always, I actually do always forget my keys in my wallet. But, so real life example, but it's just seen
Yeah,
as like
you're
a silly part of our personality. So
sure.
our executive functioning deficits get labeled as part of our personality, and they're more likely to be seen as like personality flaws rather than symptoms of a disorder. Compared to boys, these things are seen as symptoms of a disorder and or oh, he's just a boy.
Mm,
Right? It just gets chopped up
wow.
to the gender. He's just a boy. Like boys are
Yeah,
going to be boys. They're always so active, right?
yeah.
Boys have no concept of time. Like he can never keep track of time. But for a girl, it's like, oh, always get Bailey, like, tell her 15 minutes before you actually wanna meet up because she's gonna show up late, right?
Mhm.
But it's just part of her personality. It's not boys can't keep track of time or girls can't keep track of time. It's
Yeah.
just I get really frustrated with her because she's never on time, and now I'm really mad at her for never being on time.
Mm,
So, there's that's like high level working memory, time management. We have impulsivity, right? We see boys as just being naturally more impulsive.
yes.
But I one time had rainbow hair.
Oh, wow.
Yeah, I put extensions in my hair that were rainbow, just on an
Just
impulse.
'cause. Yeah.
Yeah, because yeah, I really could not tell you why. But I did, you know? So we women, we make these impulsive decisions as well. We see a lot of like impulsive shopping. But again, somebody who's an impulsive shopper, we're like, that's just part of her personality. She loves to
Right.
shop, right?
Yeah,
Or like, what's wrong with her? Why can't she control her money and her spending?
yeah,
Right? So
yeah.
we always flip it on women as something that's like inherently wrong with them
Mhm.
without ever getting deeper and realizing that there's actually something else going on, like ADHD. And so then when we are talking about what it looks like across the lifespan and these
Yeah,
multiple life events that we go through and how it impacts women and men. So we used to think that ADHD was just a childhood disorder because again we've studied it on men, and then when we were studying it on like men going from childhood into adulthood, this is when we started to what we now know what we ignored in the past, but what we now know is that the reason why we used to think that it was just a childhood disorder and that men grew out of it not
yeah.
only has to do with our hormones and how men's hormones change across their lifespan, but it also has to do with again societies, and gender roles at home. And so
Mm,
men with ADHD would end up in marriages with wives who took on their executive functioning for them. So they didn't need to work on, their executive functioning skills at home and at work and socially. They could just put all of that focus and intention at work, do well at work, come home, let it all go. The wife's going to pick it up. So we
mm.
thought it was like only childhood because men got better. It went away in adulthood. No, they had a wife who was staying at home, taking care of their executive functioning for them. Women, we don't have that luxury.
Right.
Largely, we don't have that luxury. And so now that we're understanding ADHD more and more in women, well, it gets worse for women because as we age, so do our demands, right?
Yes.
So when we're in childhood, a lot of our executive functioning can be semi managed by our parents
Yeah.
and our teachers, but then we go to college and then we're like expected to do it on our own. And there's like very little scaffolding. And so some of us fail and we fail really hard. Some of us figure it out and we're barely pulling it together. Some of us excel in school, but every other aspect of our life feels like a complete disaster all the time and is so stressful. So we can never sit in our success too, because there's always something else that's nagging us, that's telling us that we're a failure because we're not able to keep it
Yeah.
together in all domains of our life. But we get out of school and then we're in a job and we're still just like primarily in charge of taking care of ourselves,
Yeah.
right? But then we get married and then the demand grows. Okay, I have to hold this job and now I have to take care of this marriage and I also have to take care of myself. And then we get a dog. Okay, and now I have to take care of myself and I have to take care of this marriage and I have to show up for this job and I have to show up for this dog. Okay, now we have children
Yeah.
and now I have to take care of these children and I have to take care of this marriage and I have to take care of my husband and my job and myself. And I can't take care of myself. So I'm the least important and I have to throw everything to everyone else because if I tried to put an ounce of effort towards myself, everything else is going to fall apart. And so as the demands grow and the less amount of support we have when those demands grow, the more prominent the ADHD becomes.
That explains so much, and that is so true for women. The context just at baseline, of what we're responsible for, and then put ADHD into the mix of that. Yeah. I really appreciate you walking us through that and explaining it. In terms of hormones, for us, which is a big part, and I know you're starting to a little while ago we're saying, and I know in our episode 95 with you, you were talking about the hormone estrogen, which is at the top of a lot of women's minds, especially those in their 30s and 40s. But and hopefully those in their 20s are thinking preventatively. But I know you were talking about the role of estrogen in ADHD, and it was so fascinating to listen to. But basically, you were saying that as our estrogen decreases, going from our 20s into our 30s, 40s, and beyond, the symptoms of ADHD become more pronounced. Uh, I was wondering kind of how, just at baseline, because I know a lot of people think about this too, is like, how does your menstrual cycle affect ADHD when it's that time of the month? Are there any impacts there? Because I know there are impacts on lots of other things.
Yes, my favorite topic. There are a lot of impacts throughout our hormone cycle. And so, and birth control can kind of help. I'm just going to put like a little bit of a disclaimer like your hormones still fluctuate even when you're on hormonal birth control because hormonal birth control is a synthetic form of our hormones. It doesn't actually match our body's natural hormones and hormone production. So our hormones
True.
still continue to fluctuate even when we're on birth control. So birth control doesn't technically like even out or level out our hormones. So we can still have hormonal issues even when we're on birth control. And this is really important for those of us with ADHD. There's not a lot of information out there about how exactly hormonal birth control impacts ADHD, but what we
Mhm.
largely understand is that even on hormonal birth control, when you are having a regular cycle, that there's still the rise and fall of estrogen and progesterone. And that 1 week, so we have different phases, right? We have the menstrual phase, which is the
Mhm.
start of your cycle, and menses last like 1 to 5 days.
Yeah.
And then we go into the follicular phase, which is where we have this like slow rise of estrogen. And this is when our ADHD gets better, actually.
Yeah.
And so when we have more estrogen, it's like that neuro primer for our dopamine production and also our brain's ability to use dopamine. So during that time, all of our executive functioning skills feel so much easier, but we have increased challenges with impulsivity
Ah.
during this time. So it still has challenges. So,
Mhm.
but we tend to have increased bouts of like impulsivity in the follicular and the ovulation phase. And then post ovulation, our estrogen starts to decline and our progesterone starts to rise. And this is our luteal phase right before menses. And during this luteal phase, this is where the brain fog comes back. This is when our stimulant medication feels less effective or it feels like it's not working at all because we're losing that neuropriming of the estrogen in our brain. So the brain fog's there. It's harder to feel motivated. It's harder to motivation and task initiation kind of go hand in hand, right? So we like try to build up this motivation in order to start a task.
Yep.
And when we have lower estrogen and higher progesterone, just getting started feels immensely more difficult, a lot harder, 10 times harder. We
Okay.
have a harder time recalling information. We have a harder time with time management. Our I already said working memory, the recalling
Yeah.
information, and then our planning and organizing. Because planning and
Yeah.
organizing, what I think people forget is that like all of our, and I explain this all the time to my clients, is that our executive functioning
Yeah.
skills, like they got to work in tandem. Like they are puzzle
Mhm.
pieces that like have to fit and work together in order for one or the other to be successful. And so when we're experiencing challenges with one or the other, it's going to impact all of them, and it's going to make things a
That makes
lot.
complete Yeah, that makes complete sense, and really appreciate you explaining that because, like you were saying about all of the other things and responsibilities we take on, that's a part of our lives
Yeah.
every month. Right,
Yep.
for a very long time. And then in terms of the next thing is, what about pregnancy? Because this is something that's on people's minds, obviously, um, in all of these decades of the millennial age group, how did the complexities of pregnancy affect ADHD and vice versa, really?
Yeah. So again, there's like, this is what makes me so sad and so frustrated, but we have very
Yeah.
little information on women, on pregnancy and
Wow.
ADHD. But what we do know, so I can speak on like
Yeah,
what has been coming out, experience and my experience in working with clients, uh,
sure.
perinatal and postpartum,
Yeah.
is that ADHD symptoms, we tend to still have challenges with our ADHD. We're going to have challenges with our ADHD during pregnancy. And that those ADHD symptoms will really become exasperated during pregnancy.
Okay.
And they also are exasperated postpartum, especially that postpartum. Remember, your hormones take a while to like really level themselves back out. And postpartum, you're going through this huge hormonal shift that that your hormones are going all over the place, and it makes it even more difficult to manage those ADHD symptoms. But I mean, like we've heard for decades, right? Mom brain, right?
Yeah. Oh,
Um,
yeah.
now think of mom brain like times five, and that's what it feels like when you have ADHD. Is like it's mom brain, but you're still struggling because now you also have this increased demand, right? You have this whole other person that's completely reliant on you,
Yeah.
and and you're trying to take care of yourself, and you're trying to hold your job, and you're trying to take care of this little one, and at the same time your brain is just not functioning in the way that you need it to in order to do all of those things. And so in pregnancy, we also see every woman is different, and this is so what makes it really hard to study it. But we do
True.
see increased challenges with executive functioning skills during pregnancy as well.
No,
There's
extremely interesting.
Yeah.
Sorry, what did you say?
Oh, sorry, I was just gonna say, like, there's a lot of pressure on women, especially when we are pregnant, right? Like, you gotta
Oh
be
gosh, yeah.
eating, you gotta be getting sleep, you gotta hold your job still and show up for work while you're going through these huge bodily changes, and like what and like all of that requires executive functioning in order to
Oh,
show up
yeah.
and do those things, to be able to exercise and to be able to eat, to be able to shower, to be able to remember to take your vitamins, to be able to like actually sleep and like be able to stay asleep and get good sleep, right? And then
Yeah.
there's all the planning too for like preparing for the baby to come. That all requires executive functioning.
Oh, absolutely. And like you said, on top of that, with everything else, yeah, it's tremendous amount. And in terms of medication, you know, is it safe to take if you're somebody who is regularly taking ADHD medication? I know this is always a challenge for any type of medication that you're taking for any chronic condition. Sometimes you have to get off of it and reintroduce it. Um, but in terms of pregnancy, in terms of breastfeeding, kind of what is the message that you would want people to know about that?
The message that I want people to know
Yeah.
is not always the message they're going to receive. The message I want people to know is that it is safe. Unfortunately, again, clinical trials on pregnancy is really, really hard to do, and we haven't really been able to study it very much or at all up until recently because of the ethics around studying it. But from
Sure.
what has been done, what people have done, and what people have studied, and the information that we do have is that, of course, everything is individual, but
Sure.
it can be safe. And I say can be because every woman is different. Everybody's body responds and reacts differently to pregnancy. And when your body responds and reacts differently to pregnancy, it can also respond and react differently to medication during that time as well. But for many women, it has been very, very safe that
Great.
they haven't had complications. They themselves have not experienced complications. The fetus, the baby, has not experienced complications or abnormalities. I had this really wonderful psychiatrist that I worked with and collaborated with, and I think she said something that was really, really important is that, like,
Yeah.
when it comes to mental health and when it comes to medication management during pregnancy, is that yes, there is this what is safe for the baby. And of course, we don't want to do anything that's going to be unsafe for the baby. But also, we have to think about the mom's mental health and how is her mental health also going to impact the safety of the baby. Right. And so,
True.
when do we make that call, that sacrifice, and say, you know what, her mental health is needs to be taken care of in order for her to also have a safe pregnancy? And so I think, it is case by case, but it can be done really safely. The challenges or the issues that arise in pregnancy have to do mostly with like the dosage. And
Mhm.
we do know that there is a safe dosage for specific stimulant medications, and there is an unsafe dosage. And so typically it is best practice to do the lowest dose or as low of a dose as possible.
Very helpful to hear and hear. No, that's extremely helpful and extremely interesting to hear because that's something that's on everyone's mind,
Yeah.
right? Almost every except for those who've decided not to have children, but even so for their friends, everyone has a friend who is in that process at some point and going to be talking about this. For our older millennials, as you were mentioning, now in their early 40s, the other hot topic these days is perimenopause,
Oh, yeah.
and oh yes, I know, and um, what can happen with your ADHD, that's either been diagnosed or I'm thinking a lot about people who they're still at this point, they've hit 40 and like it's still not officially diagnosed, like you're talking about
Mhm.
during menopause, or there, what needs to be watched out for there.
Yeah. So I have some bad news. And that is, there's been some new studies that have come out that women with ADHD are more likely to enter perimenopause in their 30s rather than
Wow.
20s. So when we think of perimenopause, right, that is like when our body starts to decline our estrogen production in preparation for menopause. And estrogen and ADHD go hand in hand. So when we have less
Yep.
estrogen, the ADHD is going to be a lot harder to manage. And so things to look out for is like, uh, I see a lot of like chronic fatigue, and it's not. And the chronic fatigue has to do with like the brain fog and like feeling like you're tired and can't do anything. But then it's coupled with this like restlessness of like, why can't I sleep? I can't get my brain to turn off. I feel like I have this energy, but like in order to get up and go do anything, it feels impossible. Right.
Right.
So when that brain fog starts to increase, the working memory starts to feel like you're having increased deficits in working memory. Please, this is like the one that like really gets me is that women with ADHD, we also have higher risk of developing dementia and Alzheimer's. And this
Okay.
has to do with their working memory deficit. I'm not like, I don't want to come across here as like fear mongering, but if you
No.
start noticing increased deficits in your working memory, go get your hormones tested. Now is the time to really explore and go and get that assessment and see if you do have ADHD, because things that can reduce your risk for the development for Alzheimer's and dementia is hormone replacement therapy, specifically with estrogen, and
Mm.
starting that as early as possible, that is as safe as possible, and stimulant medication. It has been studied over and over and over and over again. And we have consistently seen that that is the most effective treatment for decreasing the likelihood of those developing.
Well, we're very preventatively, have a preventive mindset here at YMyHealth. So I really appreciate you bringing that up. That's great advice, and um, instead of being fearful, you want to be active,
Yeah.
and take your health into your own hands as much as you can. Obviously, along with partnership with your providers, and so that's great information that will be new. I can tell you right now
Yeah.
to yeah to listeners, and we've covered so much so far. Far as with all the differences and symptoms and hormones and the context of everything and why, these delayed diagnoses are happening. What about the process? Like, if you are experiencing symptoms that you believe are related to ADHD, or you're just experiencing symptoms, this is often the case, and you have no answers for your symptoms, and you've had them for many years since as long as you can remember, middle school, high school, right? And they're still here in your 20s, your 30s, even early 40s, what type of doctor or healthcare provider should you be seeking out if you're experiencing symptoms of ADHD, and you haven't been diagnosed, or the term hasn't even ever come up, but you're like, I'm reading about this. This sounds like this could be me.
This is surprisingly the hardest question to answer.
Oh wow.
Yeah. And the reason why it's so hard to answer it is it's actually like very simple, right? The
Mhm.
process itself sounds super simple to do.
Yeah.
But when we get to the nitty-gritty, or when we actually get into the process and we're connecting with different providers, that's where the challenges come up. And so there's many different routes to take to go and get a diagnosis. There are neuropsych evaluations, but they can be fairly expensive, but sometimes it's like the best option in order to rule out other disorders and to really verify and clarify that it's ADHD happening, and or autism or something else,
Yeah.
because oftentimes we do see that ADHD coexists with other mental health disorders like CPTSD, like OCD, like autism, etc., and anxiety and depression too. So there's that option, right? Going the route of a neuropsych evaluation with a psychologist who specializes in adult female ADHD. And so that if we're talking about women specifically, this is the key, and this is what makes it really hard because it sounds so simple, but
Yeah.
finding those providers is really hard, especially the ones who specifically specialize in adult female presentation of
Mhm.
ADHD.
Oh, I
The
bet.
other option and alternative option is to go
Yeah.
through a therapist, like myself, to do an assessment and diagnosis as well. Um, and for that too, again, the key piece is finding a therapist who specializes in adult female ADHD. And you're going to be able to tell if they specialize in adult female ADHD based off of how they talk about ADHD. And there's certainly like some red flags around ADHD and the testing and the evaluation. But really, if you like have that consultation call and that person really seems to be accurately comprehending, reflecting back to you the challenges that you're having, you're going to be able to tell if they're going to accurately assess you,
Mhm.
versus someone who tries to tell you that there's something else going on for you, uh, in what you're experiencing, right? And so
Yeah.
I'd be really listening in those consultation calls. How are they reflecting back to me? Are they telling me what's happening to me? Or are they
Mhm.
really showing me and reflecting back to me an understanding of what's happening for me? Right?
Yeah.
And then the other route to go is with a psychiatrist or a psychiatric nurse practitioner who also does ADHD testing and evaluations. Neuropsych evaluations with a psychologist is going to give you the most in depth
Okay.
answer. They tend to be the most expensive though, but you're going to get really, really in depth. But again, really looking at that consultation call and how accurately is this person reflecting back to me.
Which is extremely, extremely important, especially for women in
Yes.
particular. Would really help alleviate some of the barriers to
Mhm.
getting to the right person.
Yes.
just seeing how that is being reflected back to you. And in terms of the diagnosis process, so if you could dive a little bit into what is involved with that and like what documentation, if anything, someone would need to provide as a patient who's coming in to try and get evaluated.
But so I think that's like where this also is dependent. This is when you're going to know how accurate, how well a provider understands adult female ADHD. For me personally, I have a standard intake questionnaire that I give people, and then I give them an ADHD evaluation to do prior to like our intake appointment. But
Okay.
even with that ADHD evaluation, that assessment that I provide, and in that standard intake, questionnaire of like their history,
Okay.
some of the phrasing can be a little misleading. And so a provider who knows how to assess for ADHD is going to know how to ask the right questions and how to clarify answers or the answers that were provided on these assessments early on in these evaluations. So there shouldn't necessarily need to, you shouldn't really need to bring anything. Most people, if you're doing like a neuropsych evaluation, that's a little bit different. They
Right.
tend to ask for like copies of your progress reports. I almost forgot.
Mhm.
I was like, "What are the like report cards?" I was like, "What is
I
the
know.
word I'm searching for here?" But they typically look for and want to see like copies of your report cards from when you were in school, but not
Oh,
all of us
interesting.
have those, right?
Right. No
And then
kidding. Yeah.
yeah, and then sometimes they ask to interview someone in your life who has known you since
Mhm.
childhood,
Oh
and then
yeah.
someone who has known you in adulthood. But that's like really neuropsych based. Which obviously I don't do those types of assessments, but for the type of assessment I do, it's I go in depth in like what's underneath the symptomology
Mhm.
and asking really being able to ask the right clarifying questions to understand the individual's experience, right? So often I think this is the best example I can give is so
Yeah.
often women we describe our thought process, our mental thought process as racing thoughts, right?
Mhm.
So, but when we show up to us, most mental health providers or a doctor and they hear racing thoughts, they go, "Oh, so you have anxiety," right?
Mhm.
But what they're missing is that when we say racing thoughts, the actual experience is not that our thoughts are just, looping on the same worry and fear and we just can't let go of that like
Yeah.
racing worry and anxiety. What's actually happening is that our thoughts keep jumping, right? They're jumping
Mhm.
from this to this to this. Oh, the plants. I forgot. I got to water the plants. Oh, but then I need to repot them and I have to go to the store and I need to buy a new pot and then I need to go get the soil and then but what if I do it wrong? Should I propagate them? Is it the right time? Right? Like my thoughts
Yeah.
are jumping from
Yeah.
the
Yeah.
thing to the thing. And um I could call that racing thoughts, but it's misrepresented and people
Mhm.
misunderstand the actual experience that's happening with a racing thought. So that's one of the questions that I always clarify is like, okay, when you say you're having racing thoughts,
Yeah.
is it that you're stuck on a worry and a thought loop and the thoughts just won't be quiet? Or is it like your thoughts are jumping and you're having a hard time grasping and holding on to a thought or a piece of information or being able to stay focused on what you need to do now because what you're doing now is triggering something else that you forgot or need to remember?
That's an excellent point.
Yeah.
'Cause there's a big difference there, for sure, and again, we experience things very differently, also too. And then what about any questions that you should come in maybe asking your provider with, who you've chosen for to get an evaluation from? Is there anything you should ask them, like, to make sure, like, you think, like, they're the right person?
Yeah, I always ask because I also do this with consults that that I do with in my networking calls with providers who I'm trying to like create a referral network with. So
Sure.
any provider, like any psychiatric nurse practitioner, psychiatrist, psychologist, other therapists that I personally refer to, I've had a conversation with them and I've met them personally. And one of the questions that I always ask them is like, what is like, what's your take on ADHD in women? What's your understanding of it? And that's gonna tell you a lot.
Yeah. Oh, absolutely. Great question. Great question. And when it comes to neurodivergent affirming care, which you offer, which is incredible, what does that look like in terms of therapy for ADHD?
Yeah. This in my approach, and so I mostly speak on my approach, but I also do trainings on neurodivergent affirming care. But
Yeah.
it's like using this identity first language, helping the individual understand that there's a relationship with them and their diagnosis, and that we can build an empowering relationship with the diagnosis, that we can't cure the diagnosis. It's not going to go away. Right. So,
Yeah.
building this like radical self acceptance, this radical self compassion for this part of us that exists. And then also, it's like learning to not pathologize their behavior or seeing their behavior as a deficit or
Mhm.
as a internal flaw, but instead helping them build tools and skills to help them manage the executive functioning deficits. Where can we, what are their strengths? What executive functioning strengths do they have? And how can that help boost these other areas and or of executive functioning, and
Mhm.
or what systems, what supports, what accommodations can we implement to help manage, overcome, or increase any level of functioning with those deficits that are, or with those executive functioning skills that are considered like our weaker executive functioning skills. So my approach really leans into reducing demand because we already
Mm.
have so much demand. How
Yeah.
can we rethink about the way that we're interacting in the world and our ideas about how things should be done or are supposed to be done? But how can we instead do it in a way that works for us and adapt and modify our expectations about how that is supposed to look and be done?
Oh, that's great. That explains so much, and I can see how coming in with, you know, a way in which you already think differently as the patient, you know that in relation to society, and it's so nice to be able to come in and have somebody honing in on those strengths and figuring out a new perspective, like you said, a new way of reframing, um, how to manage these different things successfully, to have a great quality of life. And speaking of management, what are some of the symptoms or challenges that you work to help your clients manage, like just in daily life?
Yeah, yeah. No, again, everybody is really individual, but a lot of
Sure.
the clients that I see are perfectionists, really high achievers, and
Sure.
I, I just, all my clients hold such a special place in my heart, and I'm so grateful for them, and I just love and adore them all so much. And so whenever I like think about this question, I'm thinking about like how amazing each and every one of them are and how unique they are and how much I love them, but how much I also want them to love themselves too.
Sure.
When I get to sit across from this client, I'm listening to this person, I'm like, "You're so cool and you don't even know, like, you're not even seeing how cool you are." But, like, I just wanna, like, shake you, be like, "You're so cool. Look at all these things that you've overcome and that you've accomplished and that you've been able to do despite having all of these other challenges too." But, like, also, yay, let's, like, work together to make it so you can keep doing these things. I do it without burning out, without feeling like a failure, without feeling like you can't celebrate your successes. Let's work on like building those healthy, strong relationships that you really want to have, but have a hard time building and maintaining and keeping. Let's help you feel like you are successful and trust that success in your job, in
Yeah.
your life, in your relationships. I know that
No,
like
abs
it was like a little like zoomed out, but yeah,
no, that's wonderful.
yeah, thank you.
You're welcome. So, in terms of, like, skills or techniques, anything, like, that if you could give an example or 2 of those that you have your clients work on and apply when things come up in their day-to-day life?
Yeah, yeah. So I'm like, okay, which skill do I
I know, you do so many things, I know.
It's like, okay, how do I pick which one do I wanna do? Which one do I think is, like, the best one? Um,
Mhm. Take your
so
time.
I think an underrated skill, and
Yeah.
everyone looks at me like, "Bailey, why? And they like people the resistance is always there when I first talk about this skill with my clients, and they're always just
Sure.
like, I get the eye roll, get the everything of like, I can't do that. I don't know how I'm gonna do that. Time blocking. Time blocking. So,
Oh,
if you have
that's a good one.
ADHD and you've heard about time blocking, I know you're cringing at me right now, but there is a way to implement time blocking that can work for you. Because I was also the huge eye roller of time blocking and keeping a calendar, and I struggled to learn and understand Google Calendar and using these systems. But once I figured out a way that worked for me, game changer, life changer.
Wow.
And so, there's so many different ways to do time blocking. And a lot of the ways in which it's talked about, it seems to be like really kind of black and white, or there's like this very specific way. But I like to think of anything that is out there can be done uniquely to work for you. And
Yeah,
we don't always have to follow the rules about how something is supposed to be done, but we can adapt it to make it work for us.
that's great. That no, that's absolutely great, and I can see
And to be
that in
honest,
today's
mhm,
world with all the different demands, like you said, I can see excuse me, I can see time blocking being extremely effective in organizing just for most people in general, but then even more so in the context of ADHD, having that ability to do that. Absolutely. And how do you know if treatment is working?
mm, that is fabulous. How do you know?
Thank you. I was gonna say, how do you evaluate? You've been working with somebody for a couple months, like, how do you know?
Well, again, this is like so individual, but I think what I measure a lot is the self-acceptance piece. So
Uh,
it's less about like because here's the reality with all mental health. Like this is
yeah,
going to be a little bit more blanket. Doesn't matter if we're treating ADHD, anxiety, depression, etc. Anything and everything we do is not always going to work 100% of the time. That
sure.
it is going to vary. So if we find something that works for you majority of the time, great. We won. There's progress there. Now, but I measure true improvement based off of how much my clients can sit back and have the ability to sit in the nuance and the gray and lean into the trust of like, I've like things have gotten better, and I didn't realize how much things have gotten better until now I'm faced with this like new challenge. And
Sure.
here's how I'm approaching this new challenge way differently than I would have approached it in the past. And that right there is growth. And that right there
Yeah.
tells me that they're making progress. So it's less about like how perfectly do we adapt new skills, or like are the new executive functioning supports always working, but more about how is the individual feeling about themselves and their confidence in their ability to handle hard things.
Yeah. No, that's very, very helpful to hear. And one of those things that hard speaking of hard things, I think can be a little daunting is thinking about relationships.
Yeah.
And particularly romantic partnerships and communication and intimacy, in those relationships, knowing that you have ADHD and wondering how a partner will react to that and how that will play out in terms of those things. So, in your experience, how does ADHD or how can it affect romantic partnerships, communication, and intimacy?
So, just like anything else in life, I think that ADHD, the impact it has on romantic partnerships is going to be dependent on who you're in a relationship with and how accepting and how supportive they are of the ADHD. And can they learn to work with it with you? Or are they going to pathologize it and use it against you and put you down
Right.
because of it? Right. And so, my husband and I, we both have ADHD. And in the fall and this is where I also really hate the research, because a lot of the research is very negative around ADHD and marriages and relationships.
Right.
But in this November, my husband and I were celebrating 10 years together, 4 years married, 4 years together.
Congratulations.
Thank you.
Wow.
And so I think like what we've learned is that because ADHD has these unique challenges, he has his executive functioning strengths. I have my executive functioning strengths. And how can we put our strengths together to help each other where we have differing weaknesses or the same weakness? And how can we utilize our communication, but also to, build that radical self acceptance, but mutual acceptance for each other that ADHD sometimes is going to impact us more than other times, but sometimes our ADHD can really be a strong part of the relationship that keeps us connected and gives us a really fun and exciting relationship too.
That's wonderful. Wonderful to hear. And again, congratulations. That's super
Yeah.
exciting.
Thanks. I haven't
Oh.
heard them at all.
So in terms of career, how does ADHD affect somebody's ability in terms of meeting deadlines and staying focused while not becoming burned out, which is so hard to do today?
Yeah, it's so hard not to do today. I think that uh, communication is key. And oftentimes, what I see is with my ADHD clients who are successful in their careers,
Yeah.
they have those self advocacy skills and they have the ability to talk about their challenges in a way that is helps them be accepted, but also helps
Mhm.
them be supported in the workplace. Now, challenges, difficulties can still come up. I mean, we're human, right?
Yeah.
But the when I think self-advocacy and earlier communication is key in order to be able to be successful in our job and also to ensure that we're in a workplace and we're in working with a manager who is going to be supportive. And if we do that self-advocacy, if we do that early communication, if we identify and communicate the challenges that we're having in our job and our work and trying to get
Yeah.
things done, and that person we're not receiving the support, then I think that's more information for us to take away that maybe this is not the right workplace for me.
That's no, that's very, very insightful and helpful to hear. And also in terms of communicating early, what are your recommendations to clients when it comes to whether or not they disclose their ADHD to their employer? Because that has to be a tough
Wow.
decision.
It is. It's a really tough decision, and a lot of people are very scared to do it because
Of
of
course.
stigma. However, I tend to lean more on the side of if your ADHD has a history of showing up and causing challenges at work and is making it hard for you to be able to maintain, sustain, or hold down a job, that the earlier you disclose, the better, because
Mhm.
we can ensure that there are protections put into place in advance that prevent you from being put on a performance evaluation plan, um,
Mm.
et cetera, things like that. But I think that self disclosure is everyone's individual choice. I can see the pros and cons to it. And, but I think this comes up more in the interview process when you're looking for a job is like, asking in those interviews, what is the company policies on neurodivergence? What are the company's policies on reasonable accommodations? How does one go about that? How does the company treat employees who are neurodivergent, or how does the company support neurodivergent employees, et cetera? I think those are all things that you can suss out really early on to even identify if that's going to be a supportive workplace for you.
Excellent questions and very, very helpful to think about because that is just such a challenge as you said. And in terms of, you know, work life, what are some things that you recommend to clients to manage their ADHD symptoms in that workplace as well?
It's like, I think this, communication is key, but also boundaries and really having like it's okay to have boundaries. Don't go into a job and overcommit and try to over excel early on because that in the long run can actually hurt you.
Mhm.
Because our capacity is constantly fluctuating. So if we dive headfirst into a job trying to prove our worth and our ability to have that job and like why they made a good choice hiring us, we're setting an expectation early on that we're going to overfunction in that position, and that's just not sustainable. And so having those boundaries early on of like slowly building the capacity and communicating what our capacity is, having those boundaries, being able to shut work down and not force ourselves or try to bring work home with us is going to be really important in order to manage and reduce the possibility of that burnout happening.
That's outstanding advice and an excellent point because I think a lot of people do, if they're coming in with any type of chronic condition that would affect their work life, and ADHD especially, want to like be this shining example from day one and like work, but like you said, and work incredibly hard and maybe even extra, but you can't do that long term. No one can do that long term. And so, yeah, so that's just really, really excellent point. And in terms of home and social life, what are some things that you recommend to clients to do kind of in trying to balance their career, obviously, with home life and those everyday fun home tasks that we all know about, and having a social life and having fun as well. How do you kind of manage symptoms there and balancing kind of all that?
Well, this is when everyone's going to hate me again. Routine. Sorry. Routine. We all hate to
Routine.
hear it. We all know it. But the practice of routine can be really, really hard and really difficult, especially when we
Sure.
have ADHD. So again, it's like working with your therapist to help you develop a plan and a routine that can help reduce the task load. Because oftentimes what I see happening is with my ADHD clients is that they go to work all week and then they neglect all the at home tasks, but then all of the at home tasks end up being piled on for the weekend. But then impulsivity kicks in, we're exhausted, we want to go have fun. So we ignore all the at home tasks and then we get overwhelmed by them and then we want to ignore them even more and then we want to put them off and then we end up back in our work week and now we're really stressed out because our home's a disaster. We feel like we're
Yeah.
a disaster, we're stressed out about work, etc. So routine and breaking down tasks, I think, is one of the best skills we can implement. So instead of trying to save all of the, at home chores for one day and having a chore day, how can we spread it out? Mondays, I dust. Tuesdays, I vacuum.
Mm.
Wednesdays, I clean the mirrors. Like, let's break it down into smaller chunks and build it into the routine in order to help manage it overall so it doesn't become this one big pile that feels really scary and hard to address.
No, that's brilliant. That makes it so much easier and so much more manageable. It's great. Great, advice and really recommendations, to help people, again, manage, and have the best quality of life. And as we wrap up this episode, as a licensed mental health counselor who works with clients living with ADHD and as someone who is living with ADHD and received a late diagnosis, what do you want people to take away from this episode and know about ADHD in women in particular in their 20s, 30s, and 40s? And I know
I
that's a big question.
Yes, it's such a big question, because I think, like, all the rhetoric around ADHD is people I think there's a lot of negative rhetoric, and then there's this, like, toxic positivity rhetoric around
Yeah.
ADHD, but I think, like, what is the most important is there's no harm in understanding it in you, that it doesn't mean that you're not capable, and it doesn't mean that there's something wrong with you. And it also doesn't always have to be looked at as like a superpower, that we don't need to put a positive spin on it, but we can learn to accept it and work with it in a way that helps us feel good about our life and feel confident in ourselves, without having to swing one way or the other and take on a specific view of our ADHD. But that the challenges are very, very real. They're very real. And I never want to diminish that or invalidate that. Um, so just holding space that like ADHD is real. ADHD has a big impact. There's nothing wrong with you. It's okay to have it. We can learn to work with it. You can learn to work with it, and you can still have a really successful, beautiful, and great life in the way that you envision it for yourself, even with it. So it doesn't have to define.
Yeah. Absolutely, absolutely. So empowering, such empowering words. Thank you so much, uh, Bailey, for coming on the podcast and taking the time to share your wealth of expertise with us.
Thank you so much for having me. I was really excited to be back, and I hope that I gave everyone something to learn from this. And I look forward to continuing all conversations around this.
Absolutely, and remind everybody where they can find you if they'd like to connect.
Yes, I'm licensed in New York and Florida, so I do accept clients in New York and Florida. And you can find me at thewavecounseling.com or on TikTok and Instagram at bailey.adhdtherapist.
Awesome. Awesome. And just want to remind everybody, if you enjoy listening to this episode, and we hope you did, and we know you learned lots of new things, always, thanks to Bailey, please like, share, and subscribe. You can also, and you can do that on Apple, wherever you decide to get your podcast, Apple or Spotify. If you prefer to watch the video, you can watch it on our YMyHealth YouTube channel and find us there as well. So we appreciate that. But thank you again so much, Bailey.
Thank you.